Started. Good morning again. This is the Using Innovative Technologies to Engage Your Community presentation with Candace Muggard. As co-founder, co-owner, managing partner, and CFO of Cat & Company, Good Health TV, and Native Reach, Candace brings 23 years of experience in message development for public health and developing strategies for community engagement. She has led the company's efforts to build the nation's first comprehensive Indigenous public health narrowcast network. Good Health TV is now broadcasting native, reflective health and wellness messaging daily in over 35 states with nearly 470 displays within tribal communities. Her resume includes work for Casey Family Programs, Centers for Medicare and Medicaid Services, SAMHSA, Centers for Disease Control, Office of Minority Health, Indian Health Service, the Department of Interior, and the Department of Justice. So let me go ahead and share my screen, and Candace, I will turn it over to you.
Thank you. Good morning. Good morning, everyone. It's so great to see you all here, especially on a Friday morning before a long weekend. I really appreciate you all taking time. Since we have such a great, nice sized group here, I thought before I started the presentation, if you would share with me what intrigued you about joining today's session, so that if you have some particular interests or questions or concerns, that I make sure that I get them addressed today. Feel free to just visit on screen or chat, whichever is most comfortable for you.
Good morning. My name is Shayla Mabey. I'm from the Seneca Nation Health System. I was interested in this presentation today because we're moving towards more communication and less, in person in the past year and a half due to the pandemic. And I have in the Good Health TV within our own clinic. So I had an interest to see what was behind all of this.
Oh, that's great. Thank you. It is a challenging time right now on how we communicate. We'll make sure we cover some of those topics. Anybody else?
Yeah, I'm Harry Brown. I'm with the USET Tribal Epidemiology Center, and I'm also familiar with Good Health TV. And specifically, I'm wondering if we can somehow use it to try to help with overcoming vaccine hesitancy, specifically COVID vaccine hesitancy, but maybe just vaccine hesitancy in general with people.
Yeah, that's an important, critically important initiative. Any others? Okay, let me check. Okay, chat's clear. So we'll get started, and I'm excited to talk about not only your experiences that you're having with Good Health TV and exposure, but how we're using technology really to even broaden and increase that net that we throw out to provide kind of like a support structure for your communities and your neighborhoods using technology. We've really gone through incredible change over the last 20 years in how we communicate. And I think we're still getting our legs under us at the community level in public health on how we can really utilize technology in a way that is smart, effective, and not diluted with a lot of other stuff that can come into play, or we find comes into play, especially became very critically apparent to us during the pandemic. We knew in public health where there were challenges with the internet and the social media channels before the pandemic, but during the pandemic, it became even more evident how at times it can cripple good and important public health initiatives if it's not carefully used. So we'll talk about that today as well. So Emma, we can pop into that next slide. Emma's so kind today. For some reason, my presentation would not load up. And so she's graciously said she'll be my hands to flip my slides for me. So thank you very much, so much, Emma. So we traditionally in communities, we based resources. If we take a look at the last 40 years, we typically looked in the community arena for information infrastructure such as TV and radio. We used friends and family. We used healthcare, health fairs. We used healthcare providers. That's really what made up foundationally in neighborhoods and communities, kind of the way in which public health messaging was shared. Important developments, health alerts. We typically in the communities and neighborhoods used those methods in years gone by. And then enter the internet. And Emma, you can flip the next slide. In a very short amount of time, we went from those being the primary sources of information to individuals now spending up to on average 6.3 hours a day using technology on their phone. And so in the public health arena, we went from having within our communities and our neighborhoods the channels which we knew we could trust and which we could deliver, and we could have outlets for conversations about public health initiatives, to individuals having access to the World Wide Web, which had really no policing in it, right? I mean, anything can exist on the World Wide Web. And for public health, it became a very critical development. About 15 years ago, I presented at the National Minority Conference out in DC, and the head of the HIV program for the federal government came up to me afterwards, and he was exhausted. He said, because daily we battle the misinformation on the internet with HIV. He said, I wish there was a way I could get people to come to just the right resources all the time. And so I'm sure any of you that are in public health can share that frustration and that concern. It's just there, everything is available literally in the palm of our hands now. And there is, as we found, and we have known all along, there's no policing to make sure information is accurate and correct. And so for 40 years, while we were journeying in the HIV research arena, the internet many times was the home to some very almost dangerous recommendations for treatment and those type of things. So we've known this in public health communications, that we've got challenges figuring out the right technologies to use to communicate to our communities. And today I'm going to visit about why it's important to really, whenever possible, look at how we can create a community exposure, a community presence in a way that public health communications can do its job. So you can click that slide again, Emma. So right now in the world we're in, community members at all age levels are bombarded by, if you take a look at the right of the screen, and I think it's kind of a fun task if you can name each one of those icons. And I'll tell you, the younger you are, the quicker you can go through those icons. And then you can almost tell what your age is by not which icons you know and which ones you don't. But I like to brag about the fact that I know how to use Venmo now because I have daughters who need money. So this is how I get to use technology. It's how I'm driven to technology. But does anybody here, anybody looking at those icons, want to mention ones they know or that they just found out about, or any of those that they don't know?
I don't know that orange cloud one between Snapchat and the phone.
Yeah, and I usually have my social media strategist on the presentation with me. I can't remember what that one is either.
And then the pink basketball.
I wonder, let me ask, I'm going to text her real quick. Does anybody know what the pink basketball is? See, this is what I do. I have like 20 somethings on staff here who do those little icon things, and they know them. I'll have to find that out.
I'm showing my age, but I don't know at least a third, maybe a half of them.
Well, you know, and it's okay to show your age, because the reality is we come to the public health sector and we bring value to it in our years of service, and we have a lot really to help in connecting with what's out there right now. And so one of the things we found in public health communications is in public health is that unfortunately, many times we're using social media not fully knowing the potential exposure or the potential damage it can do to your public health communications. So I'm sure many of you, if you've been in public health communications a while, know in the early days of Facebook, you'd post something and then there would be a dialogue of fighting underneath it, not knowing that you could do things to, you know, restrict the ability for that to happen. I mean, unfortunately, and go to the next screen, Emma, every day, literally, there are new technologies that are showing up. These were the last 4 that about 4 or 5 months ago, I asked the tech team that works in this arena, I said, what are some new ones? Clubhouse Caffeine, Instagram Reels, ZenKit to do. And I found it interesting because one of our staff members, she's a 20-something, and she has an anxiety disorder, which manifests in eating disorder. And she tells me that Instagram is probably one of the best places she feels that young women can go to talk to other women who struggle with eating and controlling their volume and body dysmorphia and everything about that. And I was like, well, tell me about it. Is it used by a public health source also, or is it, no, it's just a bunch of women talking to each other, which we know that has some merit, but think about how easily that channels into wrong thinking as well. And with her public health background, it's interesting because she'll monitor that. And from time to time, she'll show stuff to me within that. And it's a group of, there's actually a group within subgroup of like Instagram. And she'll show where misinformation comes on. And there's really there's no correction. There's nobody saying, hey, that's actually not accurate. So these technologies, when they come out and gain momentum, can be very, very damaging in the public health communications arena. And so we have to be aware and careful of what's going on out there. Emma, you can hit another screen for me, please. Most of the manners of communication right now that users want to engage in or live streaming or interactive video content. We've come so quickly in the public health communications arena to the point of literally, how do we get people to even read things beyond 3 sentences? And so that's our challenge. And so we know that pre-produced videos, blogs are really seem to have more momentum when they're written in an engaging way. Articles, blogs tend to be slowing in that you can't get too deep into it. It's just not engaged in. By our analytics, we see they just aren't read, maybe 3 or 4 lines. And then podcasts. And we know the power of images. So the manners of communications now that the end users really are asking for fall in that arena, along with they love texting and push notifications. So we know from our engagements and our analytics, once a push notification, once an app is accepted by a user, they love valuable and important push notifications, quick, to the point, and then they're gone. And what I was visiting about earlier is that we really are challenged in that reading is not the method of choice, especially in learning things that can be somewhat overwhelming. And we find public health can be overwhelming and intimidating. And so for 25, 30 years, we have focused on creating public health messaging that is engaging. And as CDC and SAMHSA know, you have to do that using methods called edutainment, because we have to lower those resistance barriers. What we're really excited about is reading literacy previously presented a barrier to self-empowerment and overall wellness because of the inability to learn that way. And we know now that with the 30 years we've been in business and using video-based education, we know you can create such a learning environment without reading literacy in public health. And it was interesting to note that Facebook, even when they work with our strategists and stuff, they tell them, don't go beyond 40 characters. Now, a character is a letter, you guys. And they're saying beyond 40 characters, people don't engage in it. So we know the challenges in front of us with what our user population is asking for at this point. Anybody have any questions so far? Okay, we can click to the next slide, Emma. We love in public health that internet does create an access method to our end users, our neighborhoods, our communities. And it also has the ability, as we see many times over, it has the ability to unite entire communities. So in public health, we like that, but we know we have to find a way to create that community with members in it that also understand the science and the public health information that we want them to share. And another thing that's really great about technology, as we see it now from a public health sector standpoint, is the ability to post in real time so that we can get urgent and important messaging out as quickly as possible. And we use that in our GoodHealthTV network, actually, where we because we manage by individual locations, we can put out urgent health messaging for communities. So say Oklahoma City has a hepatitis B outbreak, we can put it up right away, messaging about hepatitis B outbreak and measures to stay safe is a good example of that. So pop into the next screen, Emma. Okay, what keeps us awake at night in public health? Posts may contain false or misleading information that can harm community members, and anybody can post anything. I know that throughout the pandemic, there were greater efforts taken by the social media owners to start taking down misinformation. But unfortunately, unless you're kind of in that political arena, people are still flying under the radar. And so there's still a lot of misinformation being posted on the internet and in social medias. And every other person, we know too that every person who engages with our social media, the owners, Facebook, TikTok, Instagram, are tracking and influencing their behaviors. That's it's a business model. That's why they exist. They exist to make money. And so when I interact in social media, say to learn more about gardening and raising daisies, I'm suddenly getting advertisements for fertilizers for daisies, daisy seeds, and those kind of things. So the reality we need to remember, and it keeps us up at night in public health, is every time we engage in social media that way, they use our engagement with our community members to control, distract, and influence them for their business model, which I don't have a problem with. But as in public health, we need to be aware that's the ultimate reason they're there. And we also know that the social medias are set up, Facebook, it was set up for an individual rather than organizational profiles. So the algorithms favor those individuals. So a small percentage of your, if you have a social media post, a small percentage of your like people are actually seeing your posts because they are about the individual tracking, because that's where they begin to influence for purchasing. So we know the challenge once we post something in social media in public health, that very few see it, and then it gets embedded and lost within hours. So we're still left with, how do we make sure it's out there, it's current, and it's updated whenever possible, and that people can find it when they need it. And then we also know that the posts may not be culturally or community based. They may just be late. And we know for sure in public health that engagement happens when people see themselves in it, and it's relevant to their life, their family, their neighborhoods. So Emma, we can go to the next screen. And we know it completely gives us nightmares. And that is, what do we do with all this noise and distraction that's out there, especially during critical, urgent public health events? And how do we keep our community engaged with us and not falling off into misinformation or harmful information? And then how do we protect our communities as we're trying to communicate accurate and important public health information? We know from studying the consumers and how they've reacted to the pandemic, we're losing a lot of consumers that are just saying, I'm done listening to everybody. I'm done, because I don't know who to believe anymore. And I appreciate the work that our team has done over the last, they really focused on this. That's what we focus on here. But when the pandemic hit, they focused on what are we going to do to help communities engage with their public health leadership. And they came out with a great strategy to accent the GoodHealthTV initiative we have, and we now have a native reach app, which I'll share with you, that started 1.5 years ago and has actually, we have a native reach app and we have a living local app, which public health offices are now using to engage their communities. So we can go to the next slide. So we know that, as I shared with you, that emotions and cognitive biases may render efforts to counter misinformation ineffective. People are just like, I'm done. I don't know who to believe anymore. That many are left confused and exhausted and faced with challenges, closures, changing information, misinformation, polarization, lack of local communication. And when the pandemic hit, it awakened the need for a trusted community foundation. We saw quickly in our research and IT team here that we needed to find a way to shore up and build a stronger foundation at the community level, because that seemed to be where people really were still willing to say, you know what, my community leadership, I'm willing to trust them. I'm willing to listen to them. So we needed to figure out how to make sure we're connecting the dots between that trust and technologies that are out there to help do that. So we had to look at what barriers were out there and what we could do to help bring technology to the table to figure that out. Emma, you can go to the next slide. So many of you are aware of GoodHealthTV, and that's been around for about 15 years. That is a narrowcast service that can go into any location and it plays all day long programming. We use edutainment as our programming methodology to engage people so that they feel good about learning about important wellness and health information. And then I'll share with you a little bit more about the native reach, because that's a very exciting development to bring communities together. So we can go to the next slide. For those who don't know, the GoodHealthTV plays in over 500 locations in 35 states, and the GoodHealthTV is culturally reflective for the Indigenous people throughout the country, as well as the ability to be very localized, because every local narrowcast has its own essentially identity and ability to have unique programming and messaging on the right-hand panel. So although we create national Indigenous programming, if one of the communities wants to integrate, say they're doing a upcoming Baby Well clinic on dental health, we can actually integrate programming on that for that location to help bump up the awareness of the topic. So, and then if you want to click the next one, Emma. Then Native Reach was developed when we saw the shelter in place, the closures, and clinics who used to have the ability to have their health educators, their nurses, and their public health having one-on-one suddenly we saw the shelter in place, and not only were we trying to help in public health with the pandemic, but we were seeing like an 85% drop in any precancer screenings. We were just seeing other important health initiatives just essentially stopped. And so the Native Reach network, the Native Reach app was designed to take and create a local app for a neighborhood. So we have some urban, we have urban centers or a community or an area. And it's actually a smartphone app. But what we do now is through the Native Reach app, you can access it on any of your devices, smartphone, tablet, laptop, desktop, or smart TV. It integrates with our GoodHealthTV on the right side, which we can put our flat screens anywhere in communities, not just clinics as you know them, but now with shelter in place, we have locations having it put in the grocery store or the gas station, so that when there's a shelter in place, that it's playing throughout the day when people come in through that, as well as administrative buildings. And it integrates too with social media and websites so that we monitor and control the data, work with the locations to control the data that pushes out. So Harry, when you talk about the vaccine hesitancy and the need to normalize the narrative, because that's what this is really about. We need to normalize the narrative about the vaccine. We need to take it out of the political arena and bring it back into the arena where it belongs, in public health. And that happens through the community level. That's why you have successes with immunization for children, because at the community level, our public health leadership is working with the community on it. And so this technology bundle here was our way of saying, let's bring it back to the community level so we can begin to have a more consistent, normalized conversation about vaccine hesitancy, about COVID, the virus, education about the virus, about helping people make decisions not based on fear, but based on what we know is good and logical science. If you want to click in one more there. So what we're really doing is we're creating kind of a community information infrastructure that kind of got poked at, and many communities were lacking in because the local radio station maybe shut down, or newspapers weren't running anymore. So now we have really an opportunity, well, bundling these technology apps to communicate to our communities. You can go one more, Emma. And this is the app, an example of the app. And you can download the app really easily by going to the App Store. All you have to do, if you have Google, I have an iPhone, but let me see here. You go into the App Store, and then you just type in, like this one here can show you the MHA North segment, which is one of our indigenous tribes that have it. Type in MHA North segments, it should pop right up. Search. There it is. And it pops right up there, North segment, MHA North segment, and then just open it. And that'll give you, you can walk through this app to see exactly how it works. So the app itself, and I apologize, can you hop ahead? Emma, I think you're going to have to try to control the app for me because I forgot when I uploaded it. Can you click in there? Does that allow you to go into the app? Nope. Okay, go back once. I apologize. When we couldn't figure out how to get my system to do the presentation, I was going to kind of show you the app. But the app itself, so this is a MHA North segment is part of the MHA Nation, and they're up in the North Dakota area. They have the app, but I'll open this up. This is kind of silly, but I'll show it to you. So it opens up when you open up your app every morning. It'll show you the most current announcements, and then it'll have resources, featured resources, which is really important because it allows your at the community level to house information. And the nice thing about it is you use it to engage your community in all areas of public health, just not COVID. So on the screen there, you'll notice there was an example of Hawk 2 apartment fire donations. In their tribe there, they actually had a fire, and they were wanted everybody to know that they were setting up donations. Why is that important in public health? Because let me explain. When you have an app like this, you don't want to just be about, clinical messaging. You want to be about community engagement. And so MHA North segments, they'll announce a tornado. Like they had a tornado hitting one of their areas, and so they got it out on their app here to say, there's been a tornado touchdown, everybody take shelter. Okay. So people then look at this app as this is my community app here. So anything important I should pay attention to. So when a push notification comes through to say, please, vaccination clinic Tuesday at 2, come and get your vaccine if you haven't yet, people notice those push notifications, they accept them and they look at them. And within the app then, because of the structure that we provide, we house it with all kinds of public health videos so that they can highlight COVID videos at any time. They can do a push notification. I am so sorry this isn't working here, but they can pick out of our library, because at Good Health TV, we have thousands and thousands of videos. They can pick videos to promote and to do a push notification on to highlight an issue. So many of them will use the COVID videos to help normalize the conversation. So here's one on COVID-19 misconception. So the North segment then can say, you know what, on this week, we'd like to put a push notification out saying, know the facts. And we want to have it linked to this one about COVID-19 misconceptions. And so then they send that out to their community. So the app has been a really great integrated package to have with Good Health TV, in that now they have their own app that they can stay connected to their community. And if you go to the next slide, Emma, the dashboard gives you an idea of all the integration and engagement that's going on with your app. And I know here in the epidemiology world and in the grant world, for anybody else, this is good stuff, because you can show, wow, if you notice on this particular screenshot on the left side where it says popular pages, actually the one that talks about, let's talk about sugar, at that moment, 38 people wanted to know about why sugar was harmful to me. So if you understand, we help each of our app communities integrate the type of things that are important that will get their communities engaged. So it gives you a track. This is a really dated one, but it shows you the page views, the app, how many have downloaded it, how many opens there are, and it'll actually show you where people are at that are downloading the app. And so it gives you an opportunity to understand your community and say, okay, it appears that when we run something like this, there's a lot of engagement in the app. So let's be doing some of those things to keep our community engaged and seeing us as a valuable resource. So you can click on to the next one, Emma. I'm so sorry, I can't walk you through the entire app, guys. Here's just a couple of the recommendations that have come out of the apps that we have set up. So now what's really great is when we have periods of urgent, well, let's face it, this is going to be our future. We have Good Health TV, we have the Native Reach app, and now we also have a Roku bundle, which we're working with Indigenous communities to set up their own Roku channel, so that they can have a channel playing for their community that has all the health information that they need to get out at that given time. And so what we're really doing is helping Indigenous communities and neighborhoods create their own communication infrastructure. So with the Good Health TV located in public places, and we also have a Good Health TV app, but it doesn't have local information. It's more the national level. We now have the Native Reach app for the community level, and we now have the Roku bundle that we're putting together for locations so that they can live stream. So when, say, something comes up, let's talk about the Delta variant when it was starting to present itself. With the Roku app, they're now able to live stream like their tribal health director to get on and say, let's talk about what's going on with the Delta variant. So they hear from their leadership. Now, why is this better than the Facebook feed? Because people can't find it. And that's why we knew Facebook was the place to do those things. And it was interesting because Councilwoman Mayer, who's the MHA North segment leader, she said, people can never find my Facebook stuff. I'm tired of them asking me. It can never be found. And then if they find it, they read something else that contradicts it. So now they've got Good Health TV, they've got the app and the Roku live stream, a television channel. So you're really creating your own television channel, essentially. And it's so needed because community leadership needs to get out front and center in public health and be able to be seen as accessible and the ones with the trusted information. You can hop to the next page, Emma. Oh, I think this is from the First Lady's office at the Navajo Nation. They did the app to do outreach. So that's just another example. If you want to go to the next screen, Emma, I think. Just some more testimonials. And then if you want to go to the next one, I think that's it. Okay, yeah. So right now, that's kind of where we're at with trying to as quickly as possible, make sure we're putting together the right information technology bundles to get things at the community level, the trusted community level that members will come to for all of the public health information and education that's needed day to day. So I spoke a lot. Any questions I can answer? Sheila, did I say it right, Sheila? So when you talk about moving more towards communication, you're spot on in saying we got to figure out a way to do it because we're just changing. I believe that, you know, when things get to the point where people can come in again, more normalized one-on-one interaction, that will once again be helpful to health education. But I believe that the pandemic, I always look at the silver lining. I believe one of the silver linings in the pandemic has shown us that we can do things with technology that keep us feeling close to each other. So I think when you talk about we got to move more towards communication, we're trying to get through all of this to figure out a way to communicate, but not communicate with distraction and confusion and misinformation. Harry.
You said that Good Health TV has thousands of videos. Where have those come from? I mean, surely you haven't produced all of them on your own.
Pretty much, yeah. Over the last
Really?
10 years. Yeah, we have a full production studio and we produce 30 minutes of new programming every month. And most of our segments run 1 minute to 2 minutes long each. And so the accuracy for our information, we only produce programming based upon the health information put out by federal agencies such as CDC, SAMHSA, any of the federal sources that we have. We use them for our health information. So we don't do programming for any like non-recognized health initiatives. If it's not seen by the federal health agencies, we don't produce at our level that way. Everything we produce is based upon that. So yeah, we do. We have approximately, we have about over the years, we've invested almost $10 million in video production.
Wow. Okay.
Yeah.
That's impressive.
So,
yeah. And are you, well, getting to my original question at the beginning, have you found anything that seems to really work for vaccine hesitant people in the past, not with the current COVID vaccine, but you know, in the past with just, you know, vaccine hesitancy, the misinformation, disinformation that's out there about all vaccines. And I guess that leads me to another question. How do you measure the effectiveness of what you're doing in general?
Yeah. So two parts to the question. First of all, how do we address
that was two separate questions. I apologize.
That's okay. That's okay. So how have we historically handled immunization hesitancy? We find the best works by having individuals within a person's community or neighborhood, speaking about it. So we produce, that's why the Good Health TV is created, to have that community ability. So we work with various groups around the country, we have over the years, to do pieces, video pieces of, say, a young mom and why she did it, and how she feels about it, because we know that and you probably know this, Terry, in your line of work too, there's something powerful when you're watching somebody you can relate to, speak about it and speak positively about it. So when it comes to immunization or vaccine hesitancy, we continue to support how important it is to see ourselves in the message, to see ourselves in what's being shared. So that's the first thing. The second thing is, how do we measure the accuracy, not the accuracy, but how do we measure the effectiveness of what we do? It's very difficult in public health, and that we've actually worked on this many years with SAMHSA, CDC, and the various federal agencies we work for, and they understand that in public health. It's very difficult to measure. Say I saw a video about smoking cessation that the CDC puts out. Yearly, we do smoking cessation airtime with them. In public health, we know that the decision to stop smoking can take years, or it can take a series of events. So there's no boom, boom, boom. There's no way I can say, he watched the video, he quit smoking. But we do know from our surveys that we do intermittently, engagement in viewership. And we know that people find and engage in our videos because we use edutainment at a very high level. And we do know from the studies done at NIH and CDC that engagement in a health topic is a very critical step to the next step of doing it. So if we can get people engaged in the topic, then we know from science studies that they're going to more likely begin to feel like they can be part of it. One of my favorite stories is the word diverticulitis. Okay, that is a very painful inflammation disease, and the word itself, if you picked it up, you would never be able to, most of us wouldn't. I didn't even know how to say it, and I have a college degree. But the thing that we did with diverticulitis is we made just a really great little video about it. And the thing throughout the video talked about it and repeated the word so often, because we knew that if people could say it, even, it gives them a feeling of empowerment to go into the doctor and say, I think I have diverticulitis. So we know our methodology works. The government knows it works. The reality is, and I love to use the word normalize. We have to normalize health issues, right? We have to take it out of the fear realm and I'm going to die from this, and bring it into the conversation you would have in the same way you'd say, what should we make for supper tomorrow? You should say, I don't know, but I think grandpa might have diverticulitis, right? So that's our methodology in everything we do in public health here, is we try to normalize the conversation, normalize the topic, so it's not fear-based, and it's just something that flows within the family structure. We have found many, many times advocacy through influencers is where stuff happens too. So we do a lot of programming to influencers and advocates. So we'll actually do programming that doesn't target the cigarette smoker, but targets the family member, because we know they have a great influence in that, in advocacy in that person's life. Or diabetes, getting A1Cs checked. We know by telling loved ones about A1C that they help their family member or loved one with it get it checked. So we use a lot of that type of programming as well, Harry.
I'm in a way, I'm sort of relieved to hear you say you can't always directly measure, the person saw this video and boom, quit smoking. Yeah, you don't see that. There's no way to measure that.
Right.
But you do various surveys to just measure engagement and things like that. Okay.
Yeah.
Measurement is one of the hardest things to me about public health. it's much easier in clinical medicine to measure things. I bring somebody in today, their blood pressure is this measurement, I give them a medicine for that. You come back in 2 months and your blood pressure is now where it should be. That's an easy measurement.
Yeah.
But measuring the effects on a population sometimes takes decades, to see the outcome. Yeah. So
it sure does. But what we know just from human nature is that if you can take what was previously, and that's just one of the biggest things about Western medicine that always frustrated me, is they segmented and compartmentalized our health to it belonged in the sphere of your health is only relevant to you if you're dying or sick, right? And then it was compartmentalized in that there were only certain people who could fix the owie, right? So unfortunately, Western medicine in our country pulled apart, healthiness from and wellness and disease prevention from our everyday life. And we've got, in public health, we got to pull it back in and say, no, health and wellness exists in a normal day-to-day life with all of us. And it includes talking about things, about cholesterol and not being afraid to talk about it, and talking about just all attributes of our whole well-being, and not only when we go to the doctor. And not only the doctor will tell us what to do, but we are really the best advocates for our wellness when we do finally have to go to the clinic. And so we really focus here in public health communications on that. This health and wellness belongs with me. It belongs in my community. It belongs in my family. And when I need experts for things, I bring them in, but I'm still in the driver's seat. I'm still the one who comes in and says, something's going wrong with my stomach. I've tried to, eat higher fiber. I've done all these things. I'm still having a lot of pain. I want to talk to somebody. But you're in the driver's seat. And that's what we have to do in public health. We have to give people that sense of empowerment, so they're not afraid of their illness and when things aren't, but that it's another day to check things out, to work towards. So that's what we focus on here.
Yeah, basically Good Health TV is propaganda. And I love the word propaganda because it's kind of one of those funny words to me. I'm a little strange about some things, but no, propaganda now only has negative connotations. But I think people don't realize that when the word was coined, it didn't necessarily have a negative connotation. And it was not synonymous with disinformation, which is what we think of it today. But, originally propaganda was just sort of information that was put out by the authorities or the state, I think, was the original kind of meaning of it. So it can be a good thing. Unfortunately, we associate it with Stalinist Russia or, Nazi Germany, the Ministry of Propaganda. But, putting out accurate information in a palatable format is to the good, and when people hear untruths over and over again, they sort of become truth to them. But likewise,
they do.
But likewise, when people hear the truth over and over again, that also becomes the truth.
Right. And so that's why we try to find, in the technology world, we try to find ways to have that direct link between public health leadership and their community, because then we can at least keep a more pure channel by which to have those conversations. So like for example, the app is a great example for community leadership to stay connected to their community and not get it's not going to get contaminated or diluted by people injecting and saying, you should use bleach or whatever, And before the pandemic, there were people telling stupid crap all the time. It's not like suddenly people got dumb. No, there were people like that all the time. We knew that in public health. But the nice thing is with Good Health TV, with the app, and now the Roku channel, is we keep that connection pure. And so that we can do our job in public health communications and feel good that we've got that line between myself and my community member. There's no contamination coming in. And that helps you sleep better at night. So that's what we try to do here. Any other questions?
Hi, this is Nikki Comby. I didn't have a question, but I really just wanted to thank you for at the very beginning, you know, a lot of the information that you provided. I'm not in public health necessarily, but I'm a grant services specialist here in for the Mississippi Band of Choctaw Indians, and a lot of, you know, at first at the beginning of the pandemic, we're really just trying to, you know, get our feet in terms of, okay, what is essential in terms of government operations, and then what can we kind of put on the back burner until we get our feet under us. And then after a while, it just kind of turned into just routine putting out of information. A lot of it was Facebook posts, but it was just text after text after text in terms of these little flyers that you had to read. And I kept trying to reiterate, you know, at a certain point, because also for those that are working, you're getting emails because you're doing remote work now. So you're doing more emails, you're doing more texts, and more reading, that sort of thing. And so I was trying to reiterate to the fact that people are getting burnt out in terms of reading. And and so for you to say, you know, to just really reaffirm that, really what I was like, I'm getting tired of reading. I'm getting tired of reading flyers, posts, texts, emails. And so we have to engage. It's that novelty idea that we have to, you know, a person, when they get a new information transmitted in a new way, it's kind of perks up in terms of, oh, this is new. So I really like that idea that, you know, that you really took in terms of engaging the audience to, you know, to get their attention to continue, because we don't stop transmitting information just because somebody is no longer responsive to it. We have to continue to engage, because now there's a whole new avenue in terms of, it's not just information about the pandemic, now it's information about the vaccine. So I really like that part that you said.
Yeah, I appreciate that, Nikki. And, you know, I think there's two paramount barriers. There's white noise and fear. And right now we have such weary community members, and we have to help them. We have to help them get through this and not disengage, but stay engaged. So we just, you know, we do programming that's actually it has a lot of levity to it. We do one where, you know, it's just a song where one of our guys is singing about the pandemic and how he's sick of working at home. And you know, we bring levity to it through our programming day as well, and through our apps, because we got to push through the white noise and we got to push through the fear and assure people, okay, guys, we're not going to give you another three paragraph thing about how you're going to die if you don't do this, but we're going to instead use positive, affirming ways to engage you and normalize it so that it isn't fear-based, and it becomes very logical and practical about getting the vaccine. So I appreciate that, Nikki. Any other questions? Such a privilege and honor to visit with you guys today and share with you. I can't tell you how much I appreciate it.